Senator, you've been such an amazing champion for veterans healthcare. My friend, and who's a veteran advocate, and who was affected by burn pits in Iraq, Ted Corcoran, he is so appreciative for everything that you do for veterans. What are you working on now for veterans healthcare?
Yeah, so right now, one of my particular focuses is trying to pass a bill that will provide federal support for county veterans service officers. Now, why is that important? Every county and tribes also have veteran service officers who connect with veterans in their communities, where they're at, and can help them navigate access to state programs or federal programs. In fact, probably 80% of applications for health care or disability benefits actually kind of come through the county veteran service officer or the tribal veteran service officer. So they play a huge role in linking veterans with the care that they have earned through their service to the country. And there is, at this point in time, no federal contribution to their salaries, their operations. And I became aware of this in part when in Wisconsin, a previous governor had proposed, well, every county doesn't need one. Maybe we'll have one for every 3 counties or 4. It's like, wait a second, they are the boots on the ground, if you will, for connecting veterans, and they are veterans themselves. That's one of the requirements of a county veteran service officer. So we are very close to passing a bill in the Senate that would create a federal partnership with this effort, and that's really a gateway to healthcare benefits. But you mentioned your friend who was exposed to burn pits. We recently, last year, passed the PACT Act, which, as you know, recognizes that if you've had these exposures and you later develop ill health, cancer, respiratory illness, and the like, that it is most likely service-connected.
Right.
And it eases the path to get the health benefits and the disability benefits. And we are seeing that being implemented right now, and it is really a powerful story. I had a staff member when I first was elected to the House of Representatives. He had been in the Gulf War. He had been in Kuwait. Prior to his service, he was an avid cross-country runner, and he asked, his officers, would it be safe for me to be jogging out there, near those oil fields that were burning? And, oh yeah, it's fine. Well, it wasn't fine. And he returned and at first experienced his own government, the VA, saying, there's no such thing as Gulf War syndrome. There's, it's in your head. Well, there sure was. And we fought that fight. I was so proud to advance research efforts, etc. But just to see the PACT Act and his work on that, all these years later, come to fruition is, it was a long overdue promise kept, but it was broken for so many years before we passed it.
I'm so grateful to you for doing that.